Joining me via Zoom is virologist and senior research fellow at the Center for Cell Biology at the University of Ghana, Dr. Peter Quashie, for more on this. Good evening to you, Doc. Many thanks for your time.
Good evening to you and to your listeners.
Doc, it looks to me that people are now becoming symptomatic. Compared to the previous data we had, that many people were asymptomatic. Per your research on the virus, is the virus mutating?
So initially we did sequencing, and we saw that at that point, which was very early, and I think the virus had only been in the country for about 1 month, we saw that it hadn't mutated a lot. And actually, our results also point to why, possibly to why we didn't have a lot of cases, because we had the strains that we detected at that point. Looking at the global picture, those strains tend to be linked to lower symptomatic cases. So as I speak, we've just loaded another sequencing run, which is looking at the samples from another 36 patients. So once we get that, we'll be getting that later this week and analyzing it next week. We'll know whether the strains that are circulating now and have mutated to become more pathogenic, or we'll know if there's an introduction of a more pathogenic strain, as we've seen in Nigeria, where they seem to be having a few more deaths than we have.
But what you know, I know you're a scientist, you work with figures and data, but per what you know, can you pick a guess as to what is actually happening with the surging of figures?
So there's two possibilities. The first possibility, which we'll know the answer to in a few days' time, is that the virus has mutated and it's become more pathogenic, or there's a detection of a new strain, one of the strains which have been linked to increasing pathogenicity in Europe. That's one possibility. The next possibility, and I would say more likely, is that because now we are having more cases, and our official number is 10,358, but likely, as we've seen in Europe, when the official number is X, the real asymptomatic infection is maybe twice that. So probably in the public, we have 20, 30,000. So now when you have a larger population who have it, a few more of them will become symptomatic. So this is more of a symptom of having more infections. So as you have more people infected, then even if it's 1%, 1% of a lot is more than 10% of just a few. So,
per your research, the last time, indeed, you're waiting for the latest one, so you can also conclude on that. But per your research, what would you recommend? Should we change strategy as to the way we're fighting the virus?
So, I think so far, looking at the case fatality ratios in Ghana, I think the medical management seems to be doing quite well compared to elsewhere in the world. Of course, like I said, it also seems to be linked to the virus that we have. In terms of as a scientist, I can say that you can't talk to many of us who would strictly agree to relaxing social distancing protocols. The rising cases point to the fact that social distancing protocols, even when they were in effect, were probably not being followed. And that's something that as a country we have to look at, and we have to enforce it more.
Well, I'm grateful for your time, Dr. Peter Quashie. So how long are you going to take to conclude on this latest research you're conducting?
So, like I said, we loaded that run yesterday, and usually it takes a few days for that to happen. And then probably by the end of next week, we should have some preliminary results on that.
And what difference will that research make to our fight against this virus?
So that would tell us if we have the same viruses that we detected in April still circulating, whether we have new mutations, and we expect to have new mutations, but we'll see whether those new mutations are linked to our having more symptomatic patients compared to before. The other thing I'll say is that in our early infections, we had a lot of younger patients. So it would be interesting when we look at the clinical data to see how many of them, if we are shifting from younger patients to older patients, then that would explain why you have more symptomatic infections.
I'm extremely grateful for your time. Dr. Peter Quashie is a virologist and senior research fellow at the West Africa Center for Cell Biology at the University of Ghana. Today.